Okay, anything else on any of those? Okay, so we're ready to start talking about sequencing. The bottom of page 458. And really, there's really no difference here than anything else. You're going to follow the definition of principal diagnosis. It's as simple as that. After admission, after we do the study, we want to look and see why were they admitted to the hospital. Okay? There's nothing in there that tells you that just because they have cancer that takes precedence. Okay? Nothing like that. So for instance, if they come in for a complication due to the cancer, doesn't mean you're going to put the cancer first. If they were treated solely for the complication, then that's why they're there. So look at why were they admitted. The second thing to watch is the focus of treatment, because you may have primary and secondary sites, or you may have that complication along with the cancer. So look and see what did they focus their treatment on, because that will give you another clue as to what to code first. Okay? It talks about functionally active neoplasms. Do you remember those? Those are neoplasms. They could be benign or malignant that affect an endocrine gland. And usually because of that, there may be some associated endocrine dysfunction that you have to code in addition to that. And you can see two examples at the bottom. What they're telling you to do is code the neoplasm first and then the endocrine dysfunction. So see the hyperestrogenism due to carcinoma of the right ovary. You're going to code the neoplasm of the ovary first and then the hyperestrogenism. Same thing on the next one. You got cancer of the ovary with hirsutism. You're going to code the ovarian cancer first and then the hirsutism. Okay, so I would just kind of keep in the back of my mind whenever you're coding a cancer out of the endocrine system, any of the endocrine glands, look and see if you have some sort of endocrine dysfunction, and remember to code the neoplasm first. At the top of the next page, it's talking about, okay, you're admitted and our treatment is directed at the primary site of the neoplasm. Okay, then the primary site is the principal diagnosis. Okay, in addition to that, you would code any metastatic sites as additional codes. And you would code any complications that develop during that admission as additional codes. And the one exception to this rule, because there are always exceptions, right, is if a patient is admitted solely for chemotherapy, radiation therapy, or immunotherapy. If that's the case, you're going to assign a code out of category Z51 as your principal diagnosis, and then you would have an additional code for the neoplasm. You could have two primary neoplasms. Remember we talked about that last time. A person could have two totally separate cancers in two different places, and so each one of those will code out as a primary, and you're going to have to look at what they treated. What was the focus of treatment? Or did one of them cause the admission to the hospital and the other one is just present? Like maybe they're actually going to excise one during this admission and, just watch the other one, or start radiation on it at a later date. Okay, so maybe they plan to treat both, but only one is treated now. So look and see so you can tell which one should be principal. If they're both treated equally, then you get to pick, right? And you go in there and you're going to see which one's going to pay you more money. Then it talks about these people that are admitted to the hospital for non-neoplastic conditions, but when they get the path report back, they find out there was some cancer present. Okay? They give you two examples here in the middle of page 459. The first one is somebody that has BPH, benign prostatic hypertrophy, and so they come in to have the prostatectomy. When they get that path report back, they find out that there was a little bit of adenocarcinoma present in the prostate. But that's not why he was admitted. So that's not going to be your principal. Because even though we've got the path report back and it's after study, he didn't come in for the cancer. He came in because of the BPH, benign prostatic hypertrophy. We didn't even know he had the cancer. So it's kind of like an incidental finding, not a good one, but an incidental finding. And so you're going to use that as a secondary code. The second example they give you there is a person that has endometriosis of the uterus. They come in for a hysterectomy, and when we get that path report back, we see that they have carcinoma in situ of the cervix. Okay? Again, they didn't come in for that. They came in for the endometriosis. So that will be your principal, and the carcinoma in situ will be an additional code. Okay, treatment directed at the secondary site. Okay, if all your treatment is focused on the secondary site, then it's the principal, and you'll use an additional code for the primary site. That primary site could still be present, or it could be resected, and you could be using a history of code. But if the treatment's at the secondary site, then it's the principal. If you have both a primary and secondary site and both are treated basically equal, then they do make a decision and they say the primary site should go first. Okay, so primary, secondary, both are being treated, code the primary first. And then down at the bottom it starts in, okay, what if we have that complication and it's due to the malignant neoplasm or the treatment for the malignant neoplasm? So it may be the result of radiation therapy, or it may be the result of chemotherapy. Okay, again, if the treatment is primarily for that complication, then it's going to be the principal diagnosis, and the codes for the neoplasm will be second. As always, there is an exception to that rule as well. And you'll see that at the top of page 460. The exception is when a patient has anemia due to the neoplasm. Due to the neoplasm. Okay? In that case, the malignancy will be coded first and the anemia second. And that anemia is coded out to D63.0. So let's go look at D63.0. And that's on page 494. And you'll notice there is an instructional note there that tells you to code first the neoplasm. Okay. So this is anemia due to the cancer, because we have other codes for anemia due to chemotherapy. So if anemia is due to the treatment, either chemotherapy or radiation therapy, and the sole focus of attention is on the anemia, then the anemia is sequenced first. So it's crazy. Okay?